All right, so this video is going to look at variations in sexual behavior. Okay, now just up front, a lot of the things that are talked about in this particular video may be sensitive for some. So we just want to acknowledge that discussions of sexual behavior can invoke a wide range of reactions. As we look at some of these different variations or things that people are interested in with their sexuality, we want to approach the material with curiosity, but also try to have respect and an evidence-based perspective, right? So how can we be objective at looking at this? Okay. So I think also part of this, what we want to consider is that sexual behaviors exist kind of on a broad spectrum, right? So we can look at it in a couple different ways, a couple different spectrums. So there are some things that people are interested in that are very common, right? But then you have some things that are relatively uncommon, right? So we can look at how common something is. And then also this will vary from culture to culture and everything, but what's accepted versus what's considered controversial, okay? So with that, those are things that, we want to consider. However, the more important thing is not necessarily whether something is common or accepted, but whether it is consensual, safe, distressing, or harmful in any kind of way, right? Because there are things that can be different, atypical, right? Not necessarily what you would expect, but it's not necessarily harmful. It's not something that causes distress. It's not something that we would classify as a mental disorder, let's say, right? So those are not automatically the same things. Okay? So the bulk of what we're looking at with this are what we call paraphilias, right? So a paraphilia refers to a persistent sexual interest that are outside of what is typically considered normal, okay? But again, just because someone has that interest, just because a paraphilia exists, does not automatically mean that someone has a mental disorder, okay? So for example, one of the things that we'll look at, one type of paraphilia is what we call a fetish, right? So a fetish is when someone is sexually aroused by objects or non-sexual body parts, right? So you may hear about people who have a fetish for feet, right? Or for shoes, right? So that is not necessarily a mental disorder unless it causes significant distress or impairment, or it involves non-consenting adults or causes harm. Those two things have to be present, right? What this also means is that someone can have one of these paraphilias that we're talking about, and while it might not cause them distress, while it might not cause any kind of impairment in their life, if it's causing harm to other people, then we would classify it as a disorder and not just a paraphilia by itself, right? So that can happen in isolation. It causes harm, boom, automatically disorder, okay? Or what we can also consider is it causing the distress or some kind of impairment in some kind of way, right? So some of the examples of what we're talking about with these paraphilias, right? So we mentioned fetishes, right? So again, sexual arousal from objects or non-sexual body parts, right? So a lot of people have some type of a fetish or fantasies that they kind of engage in. And again, as long as it's not causing harm, as long as people are consenting and it's not causing distress or impairment, there's nothing wrong with having a particular interest or fetish, okay? There's a set of kind of behaviors related to BDSM, right? So B is for bondage. These are people who like to be, bound, right? Domination, so being controlling over other people and having that sense of authority or power. So with that, we can also see sometimes sadism. So this is where someone is sexually aroused at the pain of others, right? And then masochism, where people are sexually aroused by experiencing that pain, right? So this is an area with BDSM and these behaviors that we have to be careful, because if we have two or more consenting adults and there's no actual lasting permanent harm done, it would be hard for us to say that this is a disorder, right? So again, it's that fine line distinction. At what point is the pain that someone is experiencing. At what point does it go from being, normal and okay to something that is now considered a disorder? What we can see is that might vary from person to person, right? But again, what we want to consider is there consent involved? What kind of distress or impairment might it be having, and what's the level of harm? Okay. All right, you also have voyeuristic behavior. So these are people who are sexually aroused by observing others without their knowledge, right? So usually this is where the other person is undressing, or people that are engaging in some kind of sexual activity, and this is somebody who is watching, and they become sexually aroused at the thought that these other people don't know that they're watching, right? That's really what it comes down to. So this one we can see is very easily able to be a disorder if it is observing others without their consent. Okay. There's also exhibitionist, right? So these are people who enjoy and are sexually aroused by exposing themselves to other people and kind of seeing that shocked reaction of how they are, right? So with these individuals, it's not so much that they actually want to initiate a sexual behavior with that or activity with the other people, but rather they're sexually aroused by seeing the reaction that they're exposing themselves is causing to others, right? That's where we're going to see maybe a little bit of a distinction, right? There's photoeristic behavior. I always pronounce that wrong, so photoeristic, something like that. So basically this one is you are sexually aroused from the idea of like rubbing yourself against other people without their consent, right? So this can happen oftentimes on large crowds or in things like public transportation, right? They will bump into others or somehow position themselves so they can rub against them in some kind of way with the sexual body parts, right? So again, very easy to see how this one can be a disorder, and it's hard to have it without it impacting others because of harm and consent and things like that. All right, you also have the people who are pedophiles, right? So these are individuals who are sexually aroused and attracted to prepubescent children, right? So generally, it's like age 13 and younger, okay? So this is one where it's just a disorder, right? It involves harm. It involves people who cannot consent. So even if they personally don't feel any distress or an impairment from it, and many times they do not, doesn't matter. It is still considered a disorder because it involves somebody who cannot give consent, and it involves harm to other people. Okay. What we want to see, or what we want to just really emphasize, and it's been mentioned, is that at the heart of all this, it comes down to consent, right? So as we evaluate someone who's maybe exhibiting some of these behaviors, we want to ask questions such as, is everyone involved able to give informed consent? Is anyone being harmed? Is the behavior causing any kind of distress or impairment? Does it violate any other person's rights? Okay, so some behaviors are illegal rather than just being unusual because they involve children, coercion, unsuspecting individuals, or exploitation, right? So just kind of a situation for us to consider, compare these two things. Situation A, you have two adults who agree beforehand, they consent to record their sexual experience, okay? Or scenario B, situation B, two individuals engage in those same exact behaviors, but one of them is recording it unbeknownst to the other person, right? So in these two different situations, even though the actual sexual activity is the same, when we look at the video part of that, which one involves consent and which one involves victimization, okay? So people who do experience distress from this or impairment, or it's causing harm, people who are diagnosed with a disorder with one of these paraphilias, not just experiencing the actual interest itself. When we look at treatment, right, one of the things that we want to try to do, first and foremost, reduce harmful behaviors. Okay, we need to eliminate those. Treatment can also focus on improving impulse control, of addressing the actual distress from it, In particular, you also want to make sure we're protecting potential victims. So treatment itself is it's gonna vary wildly from person to person depending on what's going on. All right, so just some questions for us to consider to close it out. Reflection questions, critical thinking questions. How can psychologists respect sexual diversity while also protecting individuals from harm? How can society reduce stigma while also protecting vulnerable individuals? And what ethical responsibilities do psychologists have when addressing sexual behavior? Okay, so again, that's some questions for us to consider.